The Ministry of Health estimates that 1.5 million Ugandans are living with HIV, placing Uganda in second position after South Africa in Africa, with the highest number of people living with HIV/AIDS. Only 61% of this figure, however, are receiving antiretroviral treatment. These include children below the age of 15, pregnant and breastfeeding mothers, TB/HIV and TB/hepatitis B co-infected individuals, discordant couples, and infected individuals among vulnerable groups like prostitutes.
To officially launch,
the Ministry of Health has now introduced new guidelines which require those tested positive to begin antiretroviral therapy immediately, regardless of the state of their health.
The test and treat is supported by research findings from clinical trials and other evidence that showed that early use of the antiretroviral treatment keeps people healthy with a full life expectancy and also reduces the risk of transmitting the HIV virus to partners.
Treatment for all in Uganda has been long overdue. We have a very small margin of people infected who need to be transitioned to treatment.
The treat and test model could see the demand of ARVs go up. A 2014 UNAIDS report shows infection rates in Uganda are still high, with up to 570 young women between the ages of 15 and 24 getting infected with HIV each week. There have also been reports on ARV stockouts in the country in recent months. The minister insists the government is ready to roll out the model.
We have enough drugs for us to be able to proceed with this test and treat. So we are not in a crisis, so we don't foresee to have any stockouts as of now. All we are doing is to appeal to the Ugandans to go get tested.
This move is aimed at reducing HIV-related deaths, which by 2014 stood at 31,000, and to reduce the number of new infections. The country also wants to meet the World Health Organization's target to end the AIDS epidemic by 2030.
We will ensure that all facility staff across the country are trained on the new guidelines and that facilities are supported to requisition for adequate stock of the antiretroviral drugs to meet the slightly added demand for ARVs.
Speaking about cases of dispensing wrong drug combinations, the State Minister for Health in charge of general duties, Sarah Opendi, urged health workers in antiretroviral therapy clinics to be cautious.
If you're a nursing assistant, don't do the work of a clinical officer. If you are a clinical officer, don't do work of maybe a senior medical officer.
The new guidelines become operational with immediate effect at all health facilities countrywide. Gertrude Tumusime with Kwade, NTV.